Matt, imagine that you have the chance to meet a new patient now who's just starting on their cancer journey. Maybe they've just had the diagnosis. Everything's like a raw nerve for them. They don't know what to expect. But they've had this information that they probably have a testicular cancer. You've been through the journey, you've come out the other side, you're doing really well, but what would you say to them? What would you like to take the opportunity to say to them?
Yeah. First thing I would say that I think having structure around stuff, knowing when you're meant to be going to places, take charge of your pathway. So write down questions before you go to the doctor regarding emotions, but also about structure. So what's happening next, doctor? What 3 or 4 things do I need to make sure happen? Because you can trust in the NHS and they will probably look after you. They looked after me completely, but you being in charge of your destiny is the best thing. So take charge of the structure. So make questions, because I guarantee when you get to see your first year oncologist, you know, doctors are very important people, and you know, they've got another person to speak to. They will answer any questions that you remember to ask, so write them down. Make sure that you're in there and that you definitely know the structure. Out of that, I got real peace about knowing the journey that I was going on, and then I could, in between that, it turned to me how I coped with going to the next bit, and that's where I confided in 3 or 4 people. You know, I was very lucky that I've got Oz, Vin and Dom, the sort of 3 very close people that I know that they are, and they were the people that I turned to when I spoke to them.
So you would actually advocate speaking out about your cancer to others, like not keeping it to yourself?
Definitely, and talking to people, and again, don't have hundreds of people that you do that with, because again, they'll all want updates all of the time. So I had sort of 3 or 4 people that were always good friends with each other anyway, that would speak to each other and support me. So get yourself a small network. I would say, you know, make sure that if you have a partner or you know, like my wife has been absolutely fantastic, but again, she's obviously coping with lots of things. She's coping and keeping the house together. She's probably got a job. She's probably certainly got kids that she's got to manage and keep normal. So again, you've got to balance your moaning, your stress and your worry about actually that person has got a lot of things to juggle, because you're not doing probably as much as you were around the house and all of those sort of things. So, you know, turn to your friends, turn to your clinical nurse specialist, and make sure you use those, because they are there for this journey.
And one thing that's always a question is, what about self-monitoring after the fact? You know, like you can do self-examination.
Yeah.
It's a worry, because if you check too much, it feels like you're looking for a problem.
Yep.
And if you don't check at all, it feels like, or you're just leaving it to chance.
Yep, I did completely the wrong thing. So the idea being that if you check yourself really regularly, so I was checking myself at least 3 times a week, and because I was checking myself so thoroughly, it was hurting, and because it was hurting, I was moaning about it, and it was at the fore of my mind. And so because when I then went to see the doctor and say, look, it's hurting, and so how often are you checking yourself? Well, it's far too frequently, because the idea being that you cannot spot a change. I don't notice my daughter growing, but if I don't see somebody for 6 months and then they come back and go, wow, you've grown a lot, haven't you? And so the idea being is a similar thing with when you're checking yourself. You should leave it so that you can noticeably check a difference. And to be truthful, 6 to 7 weeks checking is I think is ample. I think that's particularly what, you know, because you're not going to be any worse off if there's that amount of time. Then you're not going to hurt it, and you know, then you can probably spot things that are there. So I definitely did the wrong thing to start with.
Yeah, advising people not to do that.
Yeah.